Hey everyone, and welcome to my channel, or welcome back. My name's Danielle and today we're talking about my dog Lady. So Lady is 12 years old, and for maybe, I don't know, a year or so, or yeah, however long it was, we noticed she had these growths on her tongue. And she was still eating and drinking normally. It didn't seem to be affecting her quality of life. But we did take her to the vet on several occasions and asked them to, what it is, and is it painful? Is it affecting her life or anything? We don't know. In the past, when we've taken her to vets, they kind of avoided the whole tongue situation and they wanted to focus on other things at the time, like skin conditions and whatnot. But we were never really given an answer about it. So recently they started becoming really big, and it was like something we were seriously concerned about. So we took Lady to a different vet. We actually took her to the Southern Cross vet here in PE. So my mom took Lady for a consultation on the 24th of January and I wasn't there. All I know is that they'd arranged that she would go for surgery on the 29th of January. They also found she had an ear infection which they would treat sort of at the same time while she was under anesthetic. So on the morning of the 29th, we took Lady to the vet at 8, and then about midday the vet called us and said that the surgeon was really happy with the outcome of the procedure. She got all of the cancerous tissue, the lumps out. However, Lady had to stay there at the vet for a night just for precautionary measures. So this morning was when we went to go fetch her, and the vet nurse was like carrying her to me, and she's like, yeah, she can't really walk right now and that. And Lady's really heavy, so I'm like struggling to hold her up, and poor Lady can barely move and she can't talk or anything. Make noises, but she was trying to make little, I don't know, it sounded like little growling, and I think it was her trying to make that noise she makes when she's excited to see us, but she can't really make noise, so it came out as the little faintest growl. So we took her home, and for the first hour or two she couldn't move. She was just laying on the bed. Now she's moving a little bit. She still seems really out of it. Like, I don't know, she's not all there yet. Probably still got a lot of pain medication in her system. Now this operation was really risky. With Lady's age, she's 12, and also just anesthetic itself is dangerous and surgery itself is dangerous. But I did have the confidence that she would come out okay. The operation was a success, and I'm so happy and relieved. She's not going to have these constant things in her mouth in the way. So today is the 30th of January, and I want to tell you sort of everything I know up to this point. So what I know so far is that Lady had cancer of her saliva glands, and that really explains a lot of things. Her saliva has been like cloudy and really strange and really bad smelling. And washing her water bowls, and that was really gross with this like cloudy saliva and that in it, that really smelled so bad. So that's going to be all gone now, which is going to be really nice. The whole surgery cost almost 5,000 Rand, and it's a lot of money, and that's why, everyone will say before you get a pet you got to realize that things like this can happen. Do you have an extra 5,000 that you can just take, when an emergency like this happens? I've got the receipt here of the costs of the surgery, and I just want to kind of highlight which things were the most expensive. So 400 Rand was something we agreed to before the surgery, was just that they could do some blood tests and see that she is okay and she will be okay throughout the surgery. The anesthesia was about 600 Rand, theatre surgical procedures and theatre surgical pack was about 500. The actual fee from the surgeon was about 800 rand, and then there was something else for around 340. So those numbers are kind of roughly, I don't want to be precisely on there just in case, I don't know, for whatever reason. But yeah, there were a lot of things that cost a considerable amount of money, and then, you know, those things plus other little 20 rand here, 30 rand there, it added up to almost 5,000 rand. So now I'm going to tell you the vet's instructions for us of taking care of her post-op. So she wrote, we have to feed her soft food until she's more, until her appetites come back, basically. We must ensure she gets all her medicine daily. And we have to book her a follow-up appointment, and that is on the 8th of February. So I'm going to go to that, definitely, and I've got questions to ask. And then I will come back and let you know all of the fine details that I may not be able to give in this today's part of the video. And I've just got a few supplies and things I kind of want to show you. So for the soft food, we're going to be using Petley's rich in ocean fish, low in glycemic carbohydrates. So for the tin food, this is Lady's favorite. It's the Petley's rich in ocean fish thing. She really likes the fish flavor, and it's actually the one in jelly. She doesn't really like the ones where you've got meat chunks in a sauce. She likes the jelly ones. So yeah, we need to give her what she likes so that we can make sure she'll eat all the medicine that I have to put in there. We've got joint support. Okay, this isn't actually part of the surgery thing, but she has arthritis, so she needs to get some of this, although she really doesn't want to. But yeah, I'm gonna find a way to get this in her system. Then I've got Metacam. It's an anti-inflammatory and sort of helps for pain, and that must be given to her once a day. It says directions 12 kilograms once a day. I think they mean 12 milligrams, but yeah. And then I got a bunch of packets. So the first packet is an antibiotic, and it's 1 tablet 2 times a day. Next packet I have is a pain medicine. Next packet I have antibiotic, and the next one is pain medicine. So getting Lady to have medicine and eat some things is really a pain. She's a really picky eater. So like I said, that's why I got the favorite tin food of hers. And then for the capsules, especially the pain medicine, I tried to like open the capsule and put it on the wet food so that she would take it in that way. But apparently the vet told us that today that the pain medicine is actually really bitter. So now what we've done is you just wrap it in a little sandwich ham thing and she eats it like that. So that should be fine from now. The antibiotic she did eat when I opened the capsule and put it over the food. The struggle is really just now with that joint medicine. That could really help her and help her with the pain and whatnot, but I don't know how to get her to eat it. So if you have suggestions, feel free to leave it down below, that I could also use for now and for future times, because she's such a picky eater. Okay, so that's my update for today. On the 8th of February, when her follow-up appointment is, I'm gonna, like I said, ask all the questions that I want, find out some more details and specifics, and then I'm gonna come back and tell you guys all about that. Felix, you are driving me nuts. Hi guys, so excuse the birds, there's nothing I can do about them, okay? It's the 5th of February and I realized I haven't filmed like making up lady's morning medicine yet. So this is her pain meds, this is her antibiotics, this is that joint care. I actually forgot that I could put it in the syringe with the other stuff, but I've been doing that now. This I have to crush up because it's really big, so then I've been crushing this up, opening this capsule, putting it in a syringe with this and a little bit of milk, and just giving it to her that way. It's not the best way, it's definitely not the easiest way, but for now, this is how I've been doing it. It's really difficult giving lady medicine. Oh my goodness, this is the last 4 of these meds, and then I probably got another, this is probably one of the last 4. So I'm so ready to not have to do this anymore. And then I've been crushing this tablet on this little lid because I thought I would be cute the other day and do it on this lovely childhood plate of mine that's so pretty and it had little rabbits on it, and then I broke it. I literally took a picture, sent it to my friend, and I was like, look at this adorable plate from my childhood. And then 2 seconds later, I broke it. So, what is my life? Okay, so I'm gonna start now. Okay, that did nothing. Oh, no, it did. Open. There's this massive tablet, and then I just squish it with this. No. Okay, so that's how I squish that. And then just get a little scoop of this. Apparently dogs are supposed to like this, but Lady cannot stand it. I don't know. She just doesn't want to eat anything that's healthy for her. I don't know how I'm going to give her that joint care for her arthritis when I don't have to syringe feed her the rest of this. So this is just the 3 powders together in the cup. And now I'm just going to take a tiny bit of milk. I don't want to add too much milk because then I have to syringe feed her like 5 times. So I'm going to try put the littlest amount in. Let me get a spoon. So I've made a putrid smelling pasty mess. The stuff smells like the insides of a fish. It's really bad. So I understand why Lady doesn't like it, but I wish she would be more tolerable of having to take it. Now I've got to get this into the syringe. This isn't working. I'm going to try put it in from the back, which I should have done first, but I just wanted to try if it would go the other way. So here is Lady's medicine for this morning. Now I'm not going to show me giving it to her because that's going to be a struggle and by myself. And I don't want to stress Lady out having this big camera equipment in front of her. She already hates this. Oh, I'm out of focus. Anyway, it smells disgusting. I can't emphasize that enough. It's like if you took the inside of a fish and put it all over this table. That's what this smells like. Hi everyone and welcome back. I know it's not welcome back to a new video, but here we are. It's the 8th of February at 6:20. Here is Lady. Today is the day when we went for her checkup again after the surgery. It's been a week. The vet was over the moon with how well it's all gone. She was saying how she was so shocked when she actually was in there doing the operation and saw how bad it actually was, and that she said that's why she phoned us, because she was like, you know, she was shocked at how bad the whole situation and how much of the mass there was. The test results came back today and it turns out it wasn't a cancer, it was an ulcer. And because she's had this ulcer for such a long time, as it's been growing, she's been chewing on it as she's trying to eat her food, and that just made everything worse and it got infected. So the surgeon who worked on her said that the operation she actually had to do was sort of cut up her tongue a bit and cut up on the sides and remove all of it. And on the one side of Lady's mouth she had 28 stitches and on the other side she had 32 stitches. Lady's all tired now because she had a very exciting and busy day traveling to the vet and saying hi to everyone who's there. It's so nice to finally have this whole situation behind us, especially since Lady's had this ulcer for such a long time and we had taken her to vets before and just nothing came from those appointments. So it's so nice to finally have it out and with such a success, you know, after how bad it was. So Lady is completely ulcer free and there is absolutely no signs of infection, no signs of anything coming back. The vet was very excited and proud over her work, and rightly so. It was a tricky and difficult procedure, you know, especially with her age, and like I keep saying, how she went there and it was worse than she thought. So for her to come out and have it all be such a success, you know, thank you to that vet. So Lady doesn't have any more antibiotics or anything to take, but she has been prescribed a pain medicine, a chronic pain medicine, which she will be taking indefinitely now. So this is Petcam. It's a generic version of Metacam. They didn't have any Metacam at the time. So she will be getting this once a day with food. And I'd like to mention, earlier when I was talking about the 12 kilograms, and it must be a mistake because it's 12 milligrams, I was wrong. I forgot that on the syringe it's on kilograms. So if your dog weighs, okay, this is the big syringe, but like if your dog, or I mean your dog probably wouldn't weigh 30 kilograms, but if it did, you would take that much medicine, and that's why it says kilograms on the box and not milliliters or whatever. Lady's been doing really well on the pain medication, especially with her arthritis as well, so she's been having a lot more energy, and it seems that she's just so much happier without all that pain. So that's the whole story with Lady and her ulcer and that whole process. If you'd like to see more of Lady, you should definitely go follow me on Instagram @alphadal and subscribe to this channel, because who knows when she'll be here again, but she definitely will be. If you enjoyed this video or just in support of Lady, hit that like button. Thank you so much for watching, and I'll see you in the next video. Bye!